Today is World AIDS Day. The world commemorates World AIDS Day on December 1st each year, and this practice started in 1988. This International Day is dedicated to bringing awareness and support for persons living with human immunodeficiency virus, HIV, and to remember those lost to acquired immunodeficiency syndrome, AIDS. This World AIDS Day 35 is an ideal time to celebrate the achievements made in the fight against HIV, and it is also a time to raise awareness about the challenges that remain. It is a call to action to enable community-led organizations to advance the progress already made towards the end of AIDS. An estimated 40 million persons are living with HIV, PL-HIV worldwide, and 224 persons living with HIV reside in the Federation. In 2021, over 1.5 million persons were infected with HIV globally. The toll in 2021 was uneven, as people 15 to 24 and young women were disproportionately affected. In the Federation, an average of 17 persons were diagnosed with HIV each year over the past 5 years. In 2023, 12 persons have been newly diagnosed with HIV, so far with 50% of these cases under 30 years of age. In 2022, 38% of the newly diagnosed cases were under 30 years. According to UNAIDS, young people are at risk for HIV, and in our population, adolescents and young persons are emerging as a vulnerable target group. We have a responsibility to protect our youths. The theme for today's celebration is Let Communities Lead. Organizations of communities at risk of HIV and those living with HIV have a significant role to play in curbing the transmission of this infectious disease. Organizations of vulnerable communities help to build trust in health services. They help health authorities gain access to key populations for the delivery of preventative and treatment services. Such communities have the potential to link persons living with HIV to patient-centered health services. Community-led organizations can add impetus to our national HIV response and advance progress towards ending AIDS. Therefore, we must let communities lead. This is a call to action for local youth organizations to come on board and partner with the Ministry of Health to curb the spread of HIV. The National HIV/AIDS Program is the mechanism that guides the Federation's response to HIV/AIDS epidemic. This program is comprehensive and covers all 4 pillars of HIV prevention and control, including response, prevention, diagnosis, and treatment. The National HIV/AIDS Program seeks to A. Respond and quickly identify vulnerable communities affected by HIV transmission using evidence-based strategies and approaches to get vital HIV prevention, testing, and treatment services to persons who need them. B. Prevent spread of increased access to HIV prevention services by all vulnerable groups. C. Diagnose by screening and testing as many persons with HIV as soon as possible. D. Treat by linking PL-HIVs to care to attain sustained viral suppression. Our National HIV/AIDS Program is built on 3 fundamental principles. 1. Confidentiality, whereby codes are used to help protect patients' information. 2. Equity and human rights. PL-HIVs have a right to the highest attainable level of health. And 3. Service without stigma and discrimination. The health team has worked tirelessly in curbing HIV transmission locally, and some of the main accomplishments include 1. Sustained availability of free antiretroviral therapy medication to all PL-HIVs. 2. Elimination of mother-to-child transmission of HIV and syphilis in 2017 and this validation status has been maintained so far. 3. Sustained HIV screening with an average of 2,300 persons being screened annually over the past 4 years. 4. Increase in the number of persons from key populations who are trained HIV testers. 5. Increase in laboratory capacity at JNF General Hospital, where samples can be processed for viral load and CD4 T lymphocyte count. Our government is committed to ensuring that the National HIV/AIDS Program is adequately staffed to support the HIV continuum of care. Our government is also committed to the allocation of funds for the implementation of pre-exposure prophylaxis, PrEP, in 2024, which is medicine that can reduce the risk of transmission of HIV. Your government is already covering the cost of HIV testing, and I can assure you that this will be sustained. The way forward, the National HIV/AIDS Program will endeavor: 1. To gain traction and wider reach with its safe sex messaging using all media platforms. 2. To increase screening and testing of those who are most at risk for HIV, including our adolescents, youths, and other vulnerable target groups. 3. To implement PrEP and HIV self-testing in early 24. 4. To link all persons diagnosed with HIV to adequate care and treatment. 5. To utilize evidence-based strategies to ensure PL-HIVs are retained in care. Persons living with HIV who maintain care can attain viral suppression and achieve undetectable viral loads. PL-HIVs with undetectable viral loads can live long and healthy lives, and they are unlikely to transmit HIV to their HIV-negative partners. The overall goal and mission of our National HIV/AIDS Program is to prevent new HIV infections and to ensure that all PL-HIVs can access the continuum of care they need and ultimately achieve viral suppression. I am confident that the Ministry of Health can collaborate with key stakeholders and community-led organizations to advance the progress made in curbing the spread of HIV and ending AIDS. I embrace the recommendation to let communities lead. Thank you.